COVID-19 medical advisory team of her own.
Right. She wrote a letter. Oops. Let me pull it up. She wrote a letter to the governor talking about her COVID-19 advisory group. They held their first meeting, I believe it was yesterday, and she wrote a letter requesting that they meet with the governor's medical advisory group and collaborate. And, yesterday we reported that the governor of the CNMI, he managed to get 20,000 rapid test kits and plans to have at least a total of 60 by the end of this week to do these community testing. So, the speaker wrote a letter and she said, we know that, slowing the spread can be done through social distancing, but there's also this other way through mass testing. And so former Senator Dennis Rodriguez Jr. is actually on that
committee
advisory group.
Yeah, so let's bring him. Hi, Senator.
He also wrote a letter to the governor's medical advisory group with a plan on doing mass testing.
Right. So let's bring up former Senator Dennis Rodriguez. Good morning, Senator.
Good morning, Hafaday, Chris, and Bree.
First of all, it's been a minute. How you doing?
I'm doing very good. Thank you. I hope you guys are doing well and staying safe as well.
How was your Easter?
Very good. Very simple. Just with the family, all day, every day with them, and it's great.
Okay.
So tell us about the advisory group that you're on with the speaker.
Yeah, and how did this end up getting formed, Senator?
Well, the speaker had called me a few days ago and asked me to be part of her advisory committee, COVID advisory committee. The speaker is very concerned about the situation and how they could, as policymakers, respond, to the recovery and respond to the aftermath, when that day ever comes. And so she's put together some people she believes that can help her. Mm-hmm. I'm given, whatever 2 cents I could provide her. And when she did call me, I did mention to her that as a Total Guam Foundation, and if I can speak a little bit about the foundation. Yeah. We were established officially established in 2017. We're actually doing the work before that, but officially through getting it through Rev and Tax and the paperwork was in 2017. We're a registered 501c3 nonprofit charitable healthcare organization, and really our main mission is to provide healthcare access to those who don't have insurance or who are underinsured. And so we've provided a great amount of service to the people of Guam through our volunteer doctors in the community, volunteer individuals. We do it through our mobile care clinic. We go out, make it easy for people because we understand people have impediments. They don't have transportation or they're, just different types of barriers. So we bring the services to them. And so we've continued that mission, and that's what we've been doing. And what we've, as an organization, when this emergency came up, is we're thinking, how can we continue to help our people, those that we service, those who are part of our mission? And we're very concerned that the testings right now, and this is understandable that it's limited, and so there's restrictions in place on who can be tested. You must fall within certain criteria. And so, we want to be able to offer our assistance to the government and be able to service those in the community that perhaps fall outside of those restrictions. That's our first mission. And number two, we know too that based on science, based on what other countries that are showing some sort of success, is that you got to be able to have these mass testings done, be able to know who are infected, treat them, isolate them, and those who are not infected, be able to get them back up and get our island back up and running. Mm-hmm. And so we've the foundation has reached out to the governor's medical advisory committee, and we told them we have through our global healthcare network, we're able to provide this to provide a mobile laboratory that's fully equipped to do about at least 450 tests a day. And so, we know that, of course, through, our organization, we go through private donations, private financing. And so we've talked to some of those people already, and people are ready to to help get this here. But the first component is we need the partnership, we need the approval of the government of Guam. And so that's why we wrote to them. We said this is what we can do. We have test kits. We have initial supply of 20,000 test kits that we can get to the island within, I believe, 25 days, with a fully equipped mobile laboratory. Mm-hmm. And so that's where it's at. And when I mentioned that to the speaker and to our advisory group, the speaker at first was saying, "Great, let's try to do this." She's been trying to advocate for mass testing. I believe she had mentioned that to me, and so there's a lot of impediments and roadblocks in getting it through, just like anything else. But Chris and Bree, if there's any silver lining in this public health emergency, is that the federal government has provided us tools that help break down these barriers. Now that with this public health emergency. The federal government has authorized local, state, and territories to be able to establish their own testing criteria, and so either through legislation or I believe through the governor's authority. So these things are possible, and so we're here as a foundation just offering our assistance, and if called upon, then we'll answer the call.
And so I know that you wrote this letter to the governor's main person, Dr. Mike Cruz, who is in charge of the Physicians Advisory Group. That was April 9th. Have you received any response from him or?
No, not yet. We haven't, and I'm sure that they're reviewing it and seeing what needs to be done. And so when I always believe everything is done through God's graces and through His intervention. And so when the speaker had called me, I believe on Sunday evening, and asked me to do this, I said, "Well, Speaker, this is something that the foundation has initiated. Take a look at it." And she says, "Well, let's do this," And so she offered to write to them and ask them to review this and take a look at it. And so we're hopeful that everyone is trying to work very hard to get this. Crisis addressed, and so I'm hoping that they'll be able to take a look at this also.
So these test kits that you were referring to, the 20,000 test kits, are these the same Solgent, right? From Solgent, the same test kits that the CNMI has?
Solgent is the biotech firm from South Korea, and they do have several different types of test kits, but the ones that we have offered are the PCR testing method. I believe that may be the same as what the CNMI had received, and also from reports that we're seeing, this is also the same type of test kits that the federal government through FEMA has purchased from South Korea firm and is providing to several states and also putting into the national stockpile. I know also that I heard Director Denorsi earlier that these are not FDA approved at this time. However, I understand that a EUA, which is emergency use authorization, I believe it's called, has been submitted to the FDA. And so what happens then is that the process is that when that is submitted, that triggers the ability of these test kits to be distributed prior to receiving an EUA. And so, that's how I believe the CNMI is able to accept it. That's how other states are able to accept it. And also the fact that there's current guidance, current regulations that allow states and territories to come up with their own testing criteria, to allow specific testing kits. Is something that I believe we should take advantage of.
Point of personal privilege, Senator.
Hey, I don't miss those.
So we had Linda Denorsi from Public Health on in the 7 o'clock hour, and I don't know if you caught it, but she seemed pretty firm on that. Since there's no EUA already in place for these test kits from South Korea, that they don't think that it's prudent to use them. And she had said that the NMI was also not going to be using them to diagnose.
It's going to be more of a
surveillance.
Yeah.
Right, yeah. So I'm not really sure. And then, so Speaker, Senator, if you could just maybe, if we already have that kind of firm stance from Linda, and as the Chief Public Health Officer, she's kind of leading the charge on this. How much are we going to continue to push for this, or do you think that when that EUA does get into place, that maybe that changes things?
Well, first of all, the foundation is not pushing it. The foundation is offering because we believe that Guam needs an additional testing capacity, and so and I respect that. If they don't want to come up with their own regulations, the speaker is aware of this. The speaker, the legislature, the senators could come up with establishing laws that allow for Guam-specific testing criteria. So those options are all on the table, and it's really up to our leaders to determine whether mass testing is a priority. And so on the foundation standpoint, we believe this is something that should be done in order to help protect more of our people. It's also, personally for me, I think it's something that should be done if we're trying to focus on getting our island back up and running, our economy, it's just our schools back up, our prisons. I heard the AG earlier. And so if without mass testing, are we going to shelter in place for any time longer? And understand these things are working. We have to recognize that, these social isolations, these orders are working. But when is the end sight? And, and when we do get to that end point, how are we going to determine whether, hey, this person is not infected, this person is infected? And so, I believe we should learn from what other countries, other jurisdictions are doing. And there's no doubt, there's no argument that mass testing is the way to address this and to truly curb that peak that everyone's talking about.
Mm-hmm. Can you tell me then a little bit more about the proposal so people have a better idea of what you submitted to the governor's advisory group? Because I'm looking at it, it talks about a mobile laboratory, on-site molecular diagnostic testing, including a container laboratory shell, mechanical and electrical installation, water service, HVAC, and storage. Is this different from what you currently have? Because I know you have a mobile clinic, but is this something completely separate?
Yeah, it's completely separate. Our mobile clinic, early on in the foundation's answer to a call from GRMC, GRMC is actually using our mobile clinic now as their emergency triage outpost. It's parked right outside the emergency room, and so they wanted to, in their effort to keep that a COVID-free hospital. I believe their intent was to use that to triage anyone that's coming into the emergency room, and use that to help in that effort. And so that's totally different from the proposal that we have offered. Okay. It's a fully equipped mobile laboratory, and this is one option. This is an option to get because we know the concept of the mobile clinic going village to village and servicing people where they're at. So with this, it's similar to what I guess you would see what's happening in the States and the U.S. mainland about these drive-through testings, right? With this, though, it takes into consideration the self-isolation requirements that we're in now, takes into consideration the transportation needs that people may not have. When we do go out and do our immunizations and our physical with the mobile clinic, you have residents walking to us when we're parked on the side of the road in the village because they don't have a ride. And so this is, that whole concept was meant to do that with this fully equipped mobile laboratory. If that doesn't work out, this is we can easily transform an existing facility into another clinic to support, the public health clinic, support the hospital, and GRMC, I hear, is also going to be doing testing. It's just a matter of being able to increase the testing capacity of our community. Okay.
And how much is something like this going to cost?
It really depends on what the government of Guam wants, right? There's that component of whether this is going to be a mobile laboratory, whether it's going to be a fixed laboratory at an existing facility. And so those all factor in. The global healthcare network that we are a part of has as well personnel, technicians that can be deployed to Guam. I think similar to what the CNMI has done. They brought in a pathologist, I believe, to help in this testing process. And so it really depends on what it is. I mean, we haven't discussed that with the with the government.
Mm-hmm.
Some of our board members and our donors, we've told them this can cost several $100,000, and so to prepare for that, if we are to be able to deploy this, then the private financing that needs to be raised to be able to do this, and so it really depends on what the government would want and what they would authorize.
Mm-hmm.
Senator, how concerned are you about the politics of this, and that he ran against the governor, and they can hold a grudge, I'm told.
I believe in people. I believe in God, that especially in times like this, that we're going to put all politics aside and do what's best for our people. I mean, being holed up in our own homes, which is good. It's good to get the chance to. I'm a homeschool teacher now. And everything
Me
else.
too.
Hey, Sabrina is too.
That's right. But it really, I think everyone is sincere about trying to get us back into some sort of normalcy. And I'm hoping and praying, and I have faith that people as well will put politics aside and just do what's right for our community, because this is something that no one in our lifetime, I believe, has ever experienced. And so we owe it to ourselves, we owe it to humanity to put everything aside and work together.
Amen.
All right. Senator, I got to ask you that someone had picked up a packet for you, the Guam Election Commission. I don't know if it's so. I mean, I've got you on the line, which is a rarity. Is there any intention running for public office? I know you got supporters out there. Can we speak to that? I know you might not think it's the time, but let's just clear the air.
Sure. And I know, yes, I got a great friends and supporters that have been encouraging me, that have picked up a packet, have been actively, getting signatures. And I told them that I didn't have any intentions to run for any office this year or anytime in the near future. But, I told them I respect that their desires and what they want. And so I would definitely consider it. And if that point in time comes when we need to make that decision comes, I know that I'll make a decision that's going to be good for my family, for myself, and what's good for Guam.
Okay, I wanted to just go back on track with.
Sorry, I thought you were done.
No, I wanted to ask who all is on the Speaker's COVID-19 advisory group.
Well, in the first call that we did yesterday, I know that former Senator Francis Santos was on the call. Karen Flores, who I believe is a registered nurse.
Yeah.
And then there was another individual who was on the call from. I guess he works at GRMC as well. Mm-hmm. But I'm not sure. The speaker would be better off in announcing who those members are. But again, the speaker, her intentions are what can we do to address the needs of the community. We've told her and I talked about how besides this aspect of mass testing and the health aspect, there are people hurting right now in our community, and so she has some plans that she's working on and thinking about and how to address this, because it's real. It's very real.
We say that every day.
Yeah.
Especially with all the people that are, you're right, that are hurting out there. So anything else that you wanted to get out, and we,
no, just follow the directives. Stay home. Wash your hands.
Stay home.
That's right, and pray. Because the good Lord, I believe everything is done for a reason, and there's always good that comes out of anything. And in this time where we're all hurting, it's a challenging time. I truly believe that some good is going to come out of this. And and every day my wife and I, we pray, we see it, we say, you know what, this is good. Every day we're with our sons and our daughter. We pray for her. She still works. She's an essential employee. And so, but there's going to be good in this, and I totally believe in the people of Guam, our leaders. I believe that we're all going to get through this together.
All right. Well, if you do get a response, let us know.
Yeah, keep us in the loop. Well, hey, Senator, we'll clear the floor and give it to you if you just if you need it. So you got my number. You can shoot me a message anytime.
Great. Thank you very much, Bree and Chris.
Okay.
Okay,
Be safe.
Senator. Wash your hands.
Bye-bye.
Bye.
Thank you.
Okay. There you go, former Senator Dennis Rodriguez. Hey, good to catch up with him. I thought it was interesting. He kept saying, believe, 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 and I kept thinking of Frank Uggan and Alicia Limtiako's slogan.
Once we get off the air, I'll post the letter that he sent to Dr. Mike Cruz, who heads up the governor's Physicians Advisory Group, so you can all have a better idea.